Sonali Rao, right? To please start the presentation, Impact of Screen Time on Ocular Surface in Children, Session 1.
Hello, you can start.
Good evening, everyone. So I'm going to present about the impact of screen time on ocular surface in children. Daily media consumption has increased in today's pediatric age group, and the use of smartphones and tablets is a new normal, especially after the COVID pandemic. So increased use often leads to a variety of asthenopic symptoms. The pediatric population is more tolerant to these symptoms generally, but many of them go undiagnosed. So there is a strong need for a uniform protocol to screen for dry eye disease irrespective of symptoms. So our study was to evaluate the impact of electronic media use on ocular surface health in children. It was a cross-sectional observational study with purposive sampling. So children attending our OPD between September 2019 to October 2020 were taken between the age group of 5 to 15 years who were using appropriate spectacle correction. Children with congenital abnormalities of the eye, autoimmune disease, prior ocular surgery, trauma, any severe allergy were excluded from the study. Statistical analysis was used using the SPSS software. So we had 78 children in the study, and each child and parent was given a standardized questionnaire to answer. A complete slit lamp examination was done, and a dry eye evaluation, which included the OSDI scoring, Schirmer's test, tear breakup time, and fluorescein staining was done. This was a questionnaire that was given to the parent. So the results were, out of the 78 children, the mean age was 11 years, 42% for females and 57% for males. So 45% of these kids used smartphone and television. That was a majority. 19% used all three devices, 19% only smartphone, 12% smartphone and computer, 5% television, and none of the children used only computer. Based on screen time, the groups were divided into two. That is, the control group, the children who use less than 1 hour of smartphone, and study group that use more than 1 hour of smartphone. In the control group, if the child used less than 3 hours of other media, they were control group 1. More than 3 hours of other media were control group 2. Whereas in the study group, if they use less than 3 hours of other media, study group 1. More than 3 hours was study group 2. And more than 4 hours of smartphone was study group 3. So we analyzed, and we had 21 kids in control group 1, 4 in control group 2, 41 in study 1, 6 in study 2 and 3. So percentage of those with symptoms increased as the screen time increased. 70% of the children had symptoms like headache, tearing, burning sensation, and headache was a predominant symptom. OSDI score was greater than 12 in 57.7% of the population. When we compared, we can see that the OSDI score increased as the screen time increased in the child with a significant p-value. Next, coming to the Schirmer's test. The Schirmer's test showed a decreasing trend as the screen time increased, with a p-value of 0.06 in the right eye and 0.02 in the left eye. But none of the study population had Schirmer's value less than 10 seconds, but it showed a decreasing trend as the duration of screen time increased. Next, we compared the T-BUT. You can see there is a decreasing trend in the tear breakup time as the screen time increased in the groups. Significant decrease in T-BUT was noticed across all the age groups as the duration of screen time increased with a significant p-value. Coming to the positive fluorescent staining, this was noted in 7.7% of the population. Though it was not statistically significant, fluorescent staining was higher in those with more screen time. So we compared our article to other articles in the literature. So the first article by Jung et al., he compared adults, and he compared the smartphone versus OSDI, and he concluded that smartphone use aggravated the OSDI score. The second study by Jung Moon et al., he compared children between 10 to 12 years, and he compared the T-BUT and fluorescent staining and concluded that smartphone use is an important dry eye risk factor in children. Study by Katharina, also she did the study in children between the age of 3 to 10 years, and she compared smartphone versus visual issues and concluded that asthenopic symptoms were higher in the video game group. The only study that contradicts the study was by Benjamin et al. However, he did the study in adults, and he compared commonly used dry eye parameters like Schirmer's, T-BUT, OSDI, and fluorescent staining, and he did not demonstrate any concordance between any of the signs or symptoms. Our study revealed that a significant portion of the study population had symptoms. The OSDI score showed a significant increase in those with very high smartphone use. TBUT showed a decreasing trend as the screen time increased. While not statistically significant, the fluorescent staining was also higher in group with high media use. While the results did not indicate a severe disease, OSDI and TBUT values showed a significant change as the duration of screen time increased. In this generation of ever-increasing dependency on electronic media devices, both children and parents need to be aware of the ill effects. So studies like these compare the direct effects of screen time on ocular surface health become very important. The limitation of our study was that it was a small sample size and a limited duration of only 1 year. So there is a need for a more holistic diagnostic policy that can diagnose dry eye disease before the apparent symptomatic manifestation in children. Thank you.
These kind of studies link more with, I think, the rate of blinking, right? That is what decreases rather than saying a dry eye. Because you could still have adequate tear production and still have these issues coming up.
Sorry, I didn't get
You
your
see,
question.
most of the screen time is linked to blinking because you
Yes.
tend to blink less. That's the major factor they say now for all this.
And also what we have noticed is as the screen is closer to the viewing point, they come with more of dry eye symptoms. So children with smartphone use had more of dryness and all the tests were positive in them. Yeah.
The screen size has been plays a role. now.
Not screen size, the distance.
The size has no role
The size did not matter.
because a lot of companies are selling bigger screens that are more expensive, saying that they're better for the eyes.
But in our study, children who used smartphone and television had lower rates of dryness than who used only smartphone for a longer duration.
So what was your duration was also a factor which was affecting it? Hours of
Yes,
screen, yeah.
yes. So the maximum dryness was in children who use more than 4 hours of smartphone.
Okay.
But I have a simple question. This is well documented. Any video user, for that matter, children or adults, anybody who uses a screen for a set of time is bound to get reduced blink rate, and it's bound. This is how computer vision syndrome has evolved over last 20 years. There's a bulk of evidence now that blink rate goes down. In fact, there are softwares, utilities, exe files available in your computer which can switch off or blank your screen for 10 seconds every 20 minutes or every 15 minutes. My point is, what is the take-home message? I mean, what exactly how does your study adds to our knowledge? I mean, how it is different for children? Is it different for children?
Yes.
And how does your study adds on to the
Yeah.
existing literature?
So, like in adults, they usually come of grittiness and fatigue and all. Children usually don't come with such complaints. They may just come with headache or just discomfort or lack of concentration. So, I think this point, we need to also measure that they may be having some amount of dryness by using high electronic media use, and it may not just be either a change of refractive error or the child is not attentive and he is not following the online classes.
No, have you followed up these cases and like 4 hours you are saying they're having, have you followed these cases and seen that there is any change after that? If they say see lesser of the hours are less, has there any effective change?
No, because we had done this study only 1 year of duration and all of them had online classes. So there was, the school hadn't opened up. So probably we can follow them up from now on since the school has opened up and see if their complaints have come down and if the parameters have improved.
See, children don't come up with the complaints as the multitude of reasons for that. They don't come up with complaints of anything.
Yes.
Because
Yeah,
their
very right.
cognition is still developing. They are into that stage where they don't know. See, if I don't know that this is a pencil, I won't be saying this is a pencil. They don't know what is to be complained about. They think that this is normal. Sabko aisa hi hai. Everybody is like that. They don't. I myself did not complain for low vision till I was in 9th standard.
Yes.
From an educated family, I was good in academics, but still till 9th standard, I felt sabko aisa hi dikhta hoga. So, what is the message from your
So these
paper?
kids are going undiagnosed because they are not complaining of with symptoms and they don't come to OPD saying that I have dryness. So this problem can be missed out.
So we should put dry eye
Yes.
disease in school screening program
Yes,
also.
we should.
So what she's trying to
So-
say is that you have to take this message to the parents.
Yes.
To the parents
So
that you do
this
that.
is
But then-
something which has to be added also into your thing,
Yes,
yeah.
absolutely.
Okay.
Yeah.
Now, any frequent change in power of the glasses the children are wearing,
No,
in which you have done this study?
so this was a cross-sectional study. So we have used children only who are wearing the appropriate correction. So we didn't take
No, one of the
somebody who is-
symptoms and sign is the change in the refractive error of the patient.
So we didn't include children who we feel were not wearing the appropriate correction. So because that would have been a confounding factor in our study. Only those children who were wearing the proper correction, who were 6x6 with the glasses, were taken into the study.
And any role of UV blockers in children,
That we did not assess in our study, sir.
in your opinion?
Yeah. My opinion, I don't think it matters because I think because children, they frequently change their glasses and the glasses get scratched, so just putting a film, I don't think is going to help them much. And they
Not
don't
film,
use screen time like
UV white
adults.
glasses are available in the market. So you
Yeah.
don't have a coating on that.
I personally don't use them
Yes, yes.
myself.
Okay, thank you.